Hello and welcome to everyone joining us in today's webinar, The Impacts of Language Barriers on the Return to Work Experience. My name is Elizabeth White, Team Lead Learning and Development with the Work Wellness Institute, and I'll be helping in hosting and moderating today's webinar. I would like to start by acknowledging that I have the privilege to live and work on the traditional, ancestral, and unceded territory of the Coast Salish peoples, Squamish, Tsleil-Waututh, and Musqueam nations. We would like to take the opportunity to thank our academic team and our 9 founding partner organizations in the Harnessing Talent Project. Harnessing Talent Alliance for Recruiting and Retaining Canadians with Disabilities and Mental Health Challenges is a 3-year project funded by Employment and Social Development Canada. And this webinar is made possible through the support of ESDC, as well as our memberships to WWI. So we would like to thank our advisory committee and speakers who contribute to this webinar series. Just to give a couple of minutes for everyone to join us, I'll go through a couple of housekeeping items. First, technically, hopefully everyone has been able to hear me thus far, whether that is through your computer speakers or potentially the conference line if you chose to dial in today. If you do need to connect with us throughout this session, please utilize the questions box that you should be able to find within that GoToWebinar panel that's hopefully showing on your screen. And there you can use that to connect with us for whatever you may need. If it is a bit of a technical issue or you have any questions, whether technically or process or about the session itself, please use that as your communication portal with us. And we will be collecting questions submitted through that box throughout the webinar, and we'll be attending to those at the Q&A section that we've held at the end of our time together today. But please don't be shy. No need to hold your questions right until the very end. As you think of them, feel free to send them through, and we'll be sure to attend to them in the dedicated Q&A session. And if we do end up running a bit out of time, we'll be sure to get any questions not answered, and we'll include them in the post communications that we have for this webinar. And just as a reminder, this presentation will be recorded, so it will be sent to you in the post-webinar communications via links, along with presentation materials, and also will be posted to our website if that's an easier avenue for you. Quick note to our members: for organizational members, ARPA Australia, a reminder that you will receive your free certificate of attendance automatically as long as you've been able to fill in that record ID field when you registered for our webinars. So make sure that's happened in order to have that process run smoothly. As well, to our individual WWI members, you will also, as a reminder, receive your free certificates of attendance automatically. I will now very excited to present and introduce our speaker with us today. We're so excited to have you here with us, Dr. Stephanie Premji. Stephanie is an associate professor at the School of Labor Studies at McMaster University. She is interested in the working conditions, health problems, and access to care and compensation of immigrant and racialized workers. And Stephanie is also the author of the edited collection, Sick and Tired: Health and Safety Inequalities. So I'm very happy to pass things over to Stephanie at this point.
Thank you so much, Elizabeth. Can you hear me?
I can hear you fine.
Okay, perfect. So I'm just going to go ahead and share my screen. Can you just let me know if you can see that?
Yes, we can see it, and it's in full screen, so that's great.
Okay, perfect. Well, thank you so much. So my name is Stephanie Premji, and I conducted this study on the impacts of language barriers on the return to work experience. So I'm very grateful for the opportunity to present some of our results today. So just a little bit of background about the study. It was funded by the WSIB. And the study had for objective to develop strategies to promote the successful return to work of workers who experience language barriers. And we defined successful return to work as return to work that is timely, safe, and sustainable. Because as we know, there is a subset of workers who initially return to work, but cannot sustain employment for various reasons. So just a little bit of context about the reasons why we conducted this study. Um, so in Canada, like other immigrant receiving countries, the proportion of the population that has a non-official language as first language has been increasing. And this is due to both immigration numbers as well as immigration patterns. And it's particularly the case in large urban centers. So for example, in the city of Toronto, 43% of the population has a non-official language as first language. Now, first language doesn't give information about language proficiency, which is language proficiency refers to somebody's ability to speak, understand, read, or write in a language. And unfortunately, there's no great data on language proficiency, but we do know that it does impact a significant proportion of the population. So what are the implications of these demographic patterns for occupational health and safety, and more specifically for return to work? So we know from previous research that workers who experience language barriers are at higher risk of work injuries and illnesses. And this is because they are overrepresented in jobs that are manual, low paid, precarious, and where they are exposed to various conditions, various dangerous working conditions. Even within the same job titles, language barriers can also increase risk. So for example, if somebody doesn't have the ability to communicate or understand health and safety information, it could put them at increased risk of work injury or illness. Importantly, it's really important to remember that sometimes they're in these jobs regardless of their educational achievements or skills, because of professional de-skilling, which happens for various reasons, including discrimination. So despite sometimes higher levels of education and work experience in other fields, they may still work in manual jobs. We also know from other research that once workers who experience language barriers get hurt or become ill on the job, that they face obstacles reporting to their supervisor or employer, and that they also face difficulties filing a workers' compensation claim. We do know that, in fact, that they are more likely to file. So despite these barriers to reporting and claim filing, there is some research indicating that they're more likely to file because perhaps because their injuries are more serious, or because perhaps they don't have alternative sources of income replacement. So when they file a claim, they experience challenges navigating the claims process, and they tend to have negative claim outcomes. And finally, we know that workers who experience language barriers have added difficulties recovering and returning to work, which is reflected, for instance, in longer disability durations, and also in lower rates of return to work. So for example, there was an internal audit at the WSIB, and the results were published in the Toronto Star through a Freedom of Information request. And what this showed was that just a little bit over a quarter of injured workers who experience language barriers and who completed a WSIB work transition program found employment. So just a little over a quarter found employment, which means that almost 3/4 did not return to work. So quite significant numbers. So it's within this context that we conducted our study, and the objective of our study was to understand the factors that give rise to unfavorable return to work conditions for workers who experience language barriers in Ontario. So the study was conducted in Ontario specifically, but as we're going to see, some of the results and recommendations are also applicable to other contexts. And the objective of the study was to identify some of the concrete strategies that could be put in place to address some of these barriers. The focus, so when we did this study, our focus was really on identifying the policies and the practices that result in these difficulties. And as we're going to see, return to work challenges often originate in the working conditions, in the delayed reporting, in the difficulties accessing care and workers' compensation, and also in the fact that these services may not properly take into account language barriers. So I don't want to really go too much into our methods for a study. They're actually outlined in our report. And I'm going to provide a link to our report after this presentation. But briefly, we interviewed injured workers, as well as individuals who work with injured workers in the return to work process, such as employers, healthcare providers, rehabilitation specialists, worker advocates, WSIB staff, and so on. So we spoke to workers, service providers to try to get a sense of what are some of the challenges and what could be done, what are some potential solutions. So from our results, we developed practical recommendations in the form of a guide on ways for various stakeholders like employers, healthcare providers, workers' compensation staff to identify and address language barriers in their specific roles in the return to work process. So we developed this guide for stakeholders, and we also developed a pamphlet for injured workers on what to do in the event of a work-related injury or illness. And this is a pamphlet that we have available in 7 languages. Again, in developing these resources, we consulted with workers and stakeholders to make sure that our recommendations were really practical and applicable to the specific contexts in which people work. So our guide outlines some of the challenges that workers who experience language barriers may face in different contexts of return to work, namely in claim processing, healthcare delivery, workplace relations, and recovery and rehabilitation. And for each of these challenges, we propose suggestions for different stakeholders. And I'm going to today present some of these challenges and recommendations while focusing on the workplace context. It's important to mention that these are really recommendations for stakeholders who work on the front lines in the process of return to work. But our study also generated recommendations for WSIB policies and practices over which frontline staff have essentially no control. One example of that is the length of training periods, which our study found to be often not sufficient in length. And this is, within the realm of policies and not something over which stakeholders really have any decision-making power. So these types of recommendations, which have to do more with systemic issues, are included in our report. And I'm not going to be really diving into these today, but I'm happy to answer questions around about some of these policies and larger practices if there are any questions after my presentation. So my focus today is really on what stakeholders like you who work on the front lines can really do to support workers who experience language barriers. So the first general issue to really think about, and I know that this is a lot of information on the slide, but I will explain what this refers to, is really, well, what are language barriers and how does one actually identify language barriers? So first of all, when we talk about language barriers, we're not, and this is why I use the expression workers who experience language barriers, because language barriers is really a characteristic of the context. It's not an individual deficit. It's not an individual level limitation. And what it really means is that it involves a continuum of difficulties communicating or understanding verbal or written information. One important point that I want to make that came out of our study is that language barriers are not always obvious. So for example, in our study, we made interpreters available to all the workers who participated in our study, but actually very few of them wanted to use an interpreter. Most of the workers who participated in our study did so without an interpreter. So the workers were able to communicate with us in the context of a research interview, but even though they were able to communicate with us, they still experienced difficulties when navigating the workers' compensation system, which is a lot more complex than a research interview. So one of the lessons is that somebody may be able to carry on a conversation in one context, but may still experience language barriers in another context. Sometimes someone may be able to carry on a conversation in one language, but they may struggle with reading or writing in that language. So, so language barriers sometimes are quite subtle. So how do you identify that somebody may be experiencing language barriers? So we developed some quick steps for stakeholders on ways to do this. And now, not all of these steps may be applicable to your particular context, but these are some of the things that people can do. The first thing is if you have access to files, forms, notes, referral emails, or other documents, is to check to make sure if language barriers are indicated anywhere. The other thing that you can do is if you suspect that there might be language barriers, you can also ask the worker if it would be helpful to have somebody help interpret. Now, again, not everyone will have access to interpretation services. And I'll come back to that in a minute because this can also be a barrier. Another strategy is to observe. So is the worker difficult to understand? Does the worker respond in a limited way? For example, yes or no answers. Is the worker showing sign that they're having difficulty understanding you? So for example, do you have to repeat your questions? Do you have to speak very slowly? Or do you have to simplify your vocabulary? Is the worker able to summarize what you've told them? So are they able to repeat to you what you've communicated? Obviously, is the worker receiving the help of somebody to communicate with you or to fill out forms? Another important finding from our study is that the workers we spoke to reported that sometimes they nod in agreement, but nodding or saying yes should not be interpreted as an indication that the worker really understands. Because a lot of workers reported that they do that despite understanding. And it's the same for signing documents. So the fact that somebody will sign a document should not be interpreted as meaning that the worker actually understands or agrees to what's in that document. Because again, many reported that they signed documents without understanding. So if any of these steps indicate that there could be language barriers, professional interpretation and translation is really considered to be the gold standard. So professional interpretation means not a family member or not a friend. Now, do you always need a professional interpreter? For very simple conversations like maybe setting up an appointment, maybe not. But if the communication is likely to be stressful for the worker or complicated, or maybe the implications of the conversations are significant, then it's really the responsibility of the service provider to make sure that a professional interpreter is present. As I mentioned, not everyone has access to professional interpreters. And in some cases, one may have to work with informal interpreters like friends and family. This can be a very convenient approach, but it can also be a problematic approach because there are concerns with informal interpretation with regards to consent, to make sure that you're really obtaining true informed consent, with confidentiality as well, especially as one is communicating health information, and with accuracy, to make sure that you're really getting and communicating accurate information. So ideally, friends and family can support workers in other ways, like helping set up appointments or providing emotional support. But ideally, one would work with a professional interpreter. At the same time, informal interpreters are sometimes the only available option. But while it may be the only available option, it's important to understand that there are pitfalls to this approach as well. So once you've identified language barriers, what are some of the challenges that may come up, and how can you address these challenges? The first thing is obviously to overcome communication obstacles. Now, many workers navigate the claim and the return to work process without being able to fully communicate and understand information. And this could be information communicated in many different ways. It could be phone calls, meetings, appointments, letters, other documents. So sometimes workers don't really understand what's going on in the process of return to work. And there could be communication gaps with different stakeholders in this respect. For example, family doctors who may not necessarily speak the worker's language and who often lack access to professional interpreters. So these communication gaps have a really negative impact on the return to work process because it can result in delays, in misunderstandings, and in complexities in the claim process. And the impact of this is that it can either postpone or prevent diagnosis, treatment, rehabilitation, recovery, and return to work. So it's important to figure out, well, how do we overcome these communication obstacles? So as I mentioned, communication involves transmitting information back and forth. And as I mentioned, systematically working with professional interpreters is the gold standard. But effective communication requires more than that. It really requires just going beyond translating information back and forth. It requires respect, empathy, and understanding of the specific context um, that really frames the experiences of injured workers who experience language barriers. So specifically, how does one do that? Practically speaking, what can you do to make sure that communication is effective beyond interpretation and just making sure that information is translated back and forth? One of the things that you can do is, even if you are working with an interpreter, is to speak directly to the worker. So ideally, face-to-face communication, especially in the context of language barriers, is really important. So that should be prioritized whenever possible. But often when an interpreter is present, our instinct is to speak to the interpreter, but one should really make an effort to look at and speak directly to the worker, which really empowers the worker. Another thing that can be done to assist in making communication more effective is to play a role, an educational role with the worker. So really assist the worker in understanding the return to work process, understanding workers' compensation. So often one has to play a little bit of an additional role, an additional educational role in cases that involve language barriers. One thing that can be done, another thing, is to make sure that workers really understand what you're saying. So, for example, by asking them to summarize information that you've communicated in their own words, but also being receptive to the information they communicate, their experiences and their concerns, and to take the time to really understand the situation. Another important aspect of effective communication is to understand the workers' social, cultural, and economic context, their social, cultural, economic background, because this really could shape their experiences and their behaviors, as we're going to see in a few minutes. But it's important to do that without making generalizations and without falling at the same time into stereotypes. So for example, understanding that perhaps workers work in an environment where the employment relationship is weak, and therefore, as a result of that, they may not feel that they have the ability to speak up. So for example, if their work accommodations are inappropriate, they may not feel like they can speak up. So really understanding the larger context is really important. And finally, involving workers in decision making. This is really one of the key findings in our study, is that a lot of workers reported that even though often interpreters were present in their interactions with stakeholders, what they said is that at one point one worker said, "No, my words are translated, but my voice is not being heard." So it's really going beyond translating and interpreting, and really making sure that workers feel supported and feel that they're being heard and that they are part of the decision-making process. Beyond communication issues, there are various other issues with the return to work process. Results have been found in other studies that workers may delay reporting for various reasons. Sometimes because they don't know about workers' compensation, or they don't understand it, or sometimes even if they know about it, they're intimidated by the process. They may be afraid of losing their job, especially when the employer is discouraging claims. And we spoke to many workers who reported that their employer was actively discouraging claims. It could also be more difficult for workers to report when in jobs where there's a lack of protocols for reporting. So for example, if a worker is working through a temporary agency where they don't really know who they should raise their concern to. And there could be difficulties also accessing healthcare providers. And at the same time, some healthcare providers may also not be willing to engage with workers' compensation because sometimes they think it's too much effort or too much paperwork. So some healthcare providers actually don't want to engage with workers' compensation, or even if they do, workers may still experience communication barriers with care providers. So there are all kinds of reasons why workers may delay reporting their work injuries and illnesses. And in many ways, delayed reporting is really, in a lot of cases that we looked at, it's really the original sin, if I can frame it that way, after which everything tends to fall apart. So often the return to work issues that we find later on actually originate quite early on and then snowball into these much larger issues. So what the workers that we spoke to mentioned is that they tended to report their injuries when they were severe enough that it actually impacted their ability to work. Some of the workers said that they would sometimes take some time off and to try to recover, and then sometimes would go back without having fully recovered at the insistence of their supervisor or employer. Delayed reporting has all sorts of negative impacts. As I mentioned, it can result in delays accessing health and rehabilitation services. It can result in health problems becoming aggravated, which obviously jeopardizes recovery and return to work. So our study looked at, well, what are some of the actions that can be taken by stakeholders, by various groups of stakeholders to address these barriers to reporting? And we provided in our guide some recommendations for employers. For example, we suggest that employers could make sure that information is provided to workers in their language about safe work practices, but also about rights and responsibilities. We also recommend that workers be provided with information about workers' compensation at the time of training, but also immediately after a work injury or illness, because often it's a very stressful and confusing time, and workers are often at a loss of what to do. Asking workers questions to better understand their concerns. So for example, if a worker is taking time off and needs time off for an illness, to really try to understand the situation and what's going on. And obviously employers also need to report work-related injuries and illnesses as mandated to make sure that they are addressed in a timely manner by the workers' compensation system. So we propose some of these recommendations in our guide. We also have recommendations not just for what employers can do to address delayed reporting, but what other stakeholders can do. One example for healthcare providers is to really ask workers about their jobs. What we found is that sometimes doctors don't do that. And it's a very gendered issue because doctors tend not to ask workers about their jobs, especially when the worker is a woman. So it's important to make those connections between those health problems and the work environment. We also have recommendations for workers' compensation staff namely to take into consideration the reasons for why workers may not have immediately reported their injury or illness, and also in how this also take into account how delayed reporting could impact the claim. So for example, it could result in a loss of witnesses or other evidence in support of the claim. Delayed reporting, as I mentioned, is a big problem that often snowballs into other problems down the line. So there are various things that can be done to make sure that these barriers are minimized. Beyond delayed reporting, there are other issues. And another one that I want to talk about today is the issue of unsuitable accommodations or modifications, which may also result in re-injury and delayed recovery. And there are a number of reasons why workers may not be properly accommodated. Sometimes workers are in jobs where employers and supervisors don't really have experience with medical recommendations. Sometimes, and as I mentioned, they tend to work in manual jobs where non-manual tasks often require language skills that the workers may not have. So it's possible that workers are in jobs where there are limited options for return to work. And because the options either involve manual labor or language skills, or they may be in jobs where the production demands are such that it is difficult to implement accommodations, or maybe accommodations require the help of coworkers, but for various reasons, the coworkers are not providing this assistance. There are also barriers that involve communication issues where sometimes workers don't understand accommodations, and sometimes they also feel excluded from the decision-making process because of language barriers, but also because of limited opportunities to really participate in those decisions. A number of workers mentioned that they actually did not feel comfortable raising concerns around work accommodations, and that when they raised concerns, that their concerns were not being heard. Lastly, another issue with accommodations is workers sometimes reported that they found it difficult to negotiate their working conditions directly with their employer because of these unequal power dynamics to which language barriers contributed. And I want to read you a quote from one of the workers that we spoke to that really highlights this difficulty negotiating directly these work accommodations. So this is a factory worker who said, okay, so I talked to the supervisor. I only speak a few simple words, but what the supervisor said, I don't understand. It was a lot. When I asked my kids to ask the supervisor about my light duty and send a doctor's note to the supervisor, but now the supervisor didn't agree. He said he didn't receive anything. The third day, it's back to normal. My hands are all swollen. I asked him, so did you give me a light duty? If you don't give me a light duty, I have to go home. And then they said, okay, you can go home. So, this quote really highlights the difficulty involved in negotiating directly with the employer, the difficult relationship here. And it also highlights the fact that many workers that we spoke to actually spoke of very difficult relationships with the employer. And in some cases reported that the employer that they felt the employer actively tried to push them out. So it's really important to consider this entire context in the return to work process. Again, there are many things that employers can do to try to minimize these barriers, like making sure that the work that is assigned is productive and meaningful, understanding obviously the significance of adhering to medical recommendations, communicating concerns about the ability to fully implement recommendations to the WSIB, preparing colleagues and supervisors to support the return to work plan. And also, when workers express concerns about their accommodations, to make sure that the suitability of the accommodation is addressed. So again, these are some of the things that can be done in the context of the workplace, and we provide in our guide suggestions for other stakeholders for things that they can do to support accommodations, make sure that accommodations are suitable. So I'm just looking at the time, and I want to quickly mention before I finish today some other challenges with return to work. So I mentioned delayed reporting and unsuitable accommodations, but our study identified a number of other challenges. For example, in the claim context, we found that often cases that involve language barriers will involve missed deadlines or gaps or inconsistencies in the claim, which really need to be taken into account. We also found that there are some coordination challenges between various stakeholders. And I just want to quickly show you, this is a little graph that we put together that where we tried to map the various stakeholders involved in the return to work process in cases involving language barriers. Often what we found is that workers interact with many different people and that their language needs may not be known to these various people or may not be addressed by these various people. So it's important to communicate information about language barriers to others involved in the claim, to note it in the file if you do have access to a file, and also to share with other stakeholders involved as much information as possible to avoid workers having to play the role of filling the gaps to every new person that they come across. Quickly, some other challenges that we identified with return to work involve in the health context, often we find that there are gaps in the medical history because sometimes workers have gone to see many different providers over the years or have relied on drop-in clinics. Sometimes there are issues with incorrect diagnosis and treatment. We also found some barriers in the rehabilitation context. Improper assessments is one of the big issues where we found that sometimes stakeholders will rely on English language tools, which may not properly capture workers' skills and abilities. We also found issues with unsuitable occupations. So this is not related to accommodations, but when workers are unable to return to the pre-injury job, what work may be available to them, what's suitable occupation. What we found is that sometimes these occupations that are determined don't actually consider the language skills, and sometimes people tend to overestimate workers' language skills, or they tend to underestimate the language requirements of certain jobs. There are also training challenges. So I mentioned issues with the length of training. Sometimes there are issues with the quality of the training provided. What we found is that sometimes even after taking English language courses, that workers still did not have sufficient language skills to do skills training. So there are some training issues as well. And difficulties finding and keeping work. We found that workers, for example, struggled in an online environment with putting together CVs or writing new cover letters for each new application was often very difficult for workers. And struggle for other reasons as well, sometimes because they are having to find a job in a completely new field for which they have no prior experience. So all this to say that for each of these challenges, our guide provides recommendations on how they may be addressed by various categories of stakeholders. So just to briefly conclude, there are various negative outcomes to not properly taking into account language barriers in return to work. There are negative outcomes for workers and their families because it can result in prolonged disability, a loss or a reduction of income, and in emotional and physical stress. There are impacts on workers' compensation as well because of longer durations of disability. And there are larger societal impacts because of perhaps reliance on other benefit systems like EI and so on. And there's also reduced contribution of individuals to their communities. So there are impacts at various levels. So especially given demographic patterns, it's important. It's an important issue. Language barrier is an important issue, and there's really a need to accommodate language barriers, as I mentioned, by addressing communication barriers, but also by making sure that the process that we follow and the decisions that we make take into account the larger context in which workers with language barriers in which they work. So on this note, I want to thank you. Thank you so much, and maybe open the floor for questions.
Thank you so much, Stephanie, for such a thorough presentation, and it's such a complex topic and all of these different things we need to consider. So we will move into our question and answer period. And just a reminder to all participants, please use that questions box in the GoToWebinar panel to communicate with us. So I'll start things off with one of our first questions here. I'm aware of situations where sick, injured workers, even those that might not even have language barriers, are actively being pushed out. This all seems to be a systemic issue where no one wants to put in the time, effort, and money into treating workers. How do you address this, especially if, as you've mentioned, sometimes there isn't even a claim in play?
Mm-hmm. I mean, that's a very difficult question to answer. It's a great question.
It's a big one to start off with.
It's a big one. It's a big one. It's one that I have also struggled with because, yes, as I mentioned, there are things that can be done, you know, to encourage workers to report their injuries and illnesses. But we know that workers don't, and the reason why often they don't is because of these systemic issues, namely the precarity of employment. So when workers feel that their job is on the line, they're not going to make a fuss. They're not going, you know, even if you provide them with information about the WSIB in their language, and you repeat that information, and you it really comes down to whether workers feel empowered to do that. I think that these issues relate to, you know, the more generally to the state of the labor market, and the fact that, for example, like the scale of temporary employment, and the fact that workers really feel that they're disposable, and in reality they are, because if they say or do anything, it's not going to end well for them. So what can be done? I think that there's work that needs to be done more generally in terms of making workplaces safer, more stable, by addressing some of the loopholes that perpetuate reliance on temporary employment agencies, and by overall addressing the more general issue of employment precarity. But I I will concede that that's a big one. That's a really big problem that cannot be solved by merely communicating information. It really goes to these deeper power issues.
Yeah, there's definitely some larger things at play, and hopefully we can all kind of do with a lot of the great recommendations you had at one level that can hopefully maybe kind of continue to build into these larger areas. One kind of hopefully a fairly quick question here, just a question around the resources you've mentioned today, the pamphlet, the guide. Are they publicly accessed? Is there a place that the audience can go and look at these? And just also confirming, are these kind of from a global perspective, or were they nation kind of Canadian specific?
Okay, good question. So yes, these are available online. And is there a way for me to share the link with you and then for you to communicate that to the attendees?
Absolutely. If you would like to share the link with us, we'll include it in the post communications for this webinar.
Okay, so I'll share the link. So all of this is accessible to be downloaded. It's online. So we have the pamphlets in 7 languages. We have the guide. The pamphlet we wrote specifically for Ontario workers because the advice is very specific to accessing the WSIB. But the guide we wrote with like a broader perspective in mind. So so you'll find that the advice is really applicable to different jurisdictions. In fact, we have people in Australia who are interested in it, people in British Columbia. So it's general enough that, and we wrote it with a more general audience in mind.
Okay, wonderful. Well, we'll be sure to include those links in the post communications as well as include it when it's on our website as well, if that's okay with you. Wonderful. So here's a question a little bit around kind of the occupational health and safety information. So one of our audience members, in my experience with the Canada Summer Student Program, it's mandatory that students are provided with OHS, occupational health and safety information in the form of pamphlets or something like that. And students are actually asked about this within the government auditing process to ensure they were provided this information. Is this not mandatory for all workers? So just speaking to that portion when you were discussing health and safety increased risk.
Yeah, so it is. So employers have a responsibility to make sure that they do everything that is reasonably practical to make the work safe. And that includes providing information. It includes providing general information, but also task-specific information and training. So employers are required to do this. But so there are 2 things. One, often employers will not do this, regardless of language barriers, because of the context, because the employees are maybe coming from temp agencies, and sometimes employers will just not invest time in training and providing that information despite the legal requirement. And then when the information is provided, what we hear is that sometimes it's not provided in a format that the workers will understand. So for example, somebody said, they're provided with like a manual in English, here, read the manual, and that's the extent of it. So there are 2 things. It may not be provided despite the requirement to do so. And when it is, it may not be in a format or in a language that makes sense. There could be different ways to provide training. And this is actually something that we're looking into to try to investigate. Well, what are some of the ways in which training could be provided in context of language barriers? A lot of the research on that actually comes from the United States, where often in the context of Spanish speakers, which is a lot simpler because usually it's one language, Spanish. But in a city like Toronto, for example, there are workplaces where there could be sometimes, dozens of languages spoken, which really creates challenges as to, well, how do you then provide information in an effective way in so many different languages? And there are different ways that people have used, sometimes, you know, using a colleague as an interpreter, like in some kind of buddy system, or people sometimes have produced videos or other ways of presenting information. Some are more resource intensive than others and maybe better used in different contexts. But there's definitely a need to develop more research around this issue of, well, how do you actually train people in situations where there might potentially be so many different languages spoken? I
Yes,
don't know if I
absolutely.
answered the question.
No, I think so, absolutely. And they can feel free to confirm in the chat as well. But yes, I think that speaks to a couple of things of A, ensuring the information is happening regardless, and then B, how do you approach more these kind of mandated or organizational policies that can kind of seem a flip of a button to you and not necessarily putting into context the actual understanding and applicability for the employees themselves. Before we get to another question, we'll just have a quick note that this has been great learning from a couple of our audience members, and just looking at all of these different barriers and learning some new ones that haven't been on their purview before. So just a note to say thank you for bringing this to our audience. When we think of, I just will have room for one more question, and just thinking about, as you mentioned, having a situation where there's multiple language barriers potentially at play, multiple different languages being spoken, what are some perhaps pros and cons you can bring around having multiple language offerings? So trying to kind of accommodate multiple languages, anything for employers particularly to consider that would be positively or maybe not so positively received.
So I'm reluctant to really frame it as a difficulty because, you know, the fear is always that employers are going to see this as too much of a hassle and therefore not employ workers who experience language barriers, right? So, so there are ways to overcome these challenges, but it's important to also understand the pitfalls of different approaches. So, for example, there's a study that I conducted in a garment factory where the way that they would train people was really through colleagues, right? So they would ask somebody who speaks the same language involved in.
Stephanie, I think you, oh.
Like, I don't use the safety guard, or, you know, because so so there's sometimes if we're using, for example, colleagues, there's potentially a risk that there will be some information that you know, ways of working that may not be safe but may increase productivity that may be encouraged. But there are some effective ways. There are some examples, for example, of videos that have been produced, like short videos that don't involve any sort of language, like any language, but that just shows some potential risks in the workplace and how to prevent them. There's a role for the Ministry of Labor to provide some resources in that regard as well, because especially for some of the smaller businesses, it may be, you know, honestly quite difficult to invest in these types of resources. And I know in some cases that some community organizations are acting as intermediaries and helping provide the training because of language barriers. So it's not a question that has an easy solution, but there are some ways to do that. But it's important to understand that there are some challenges as well. At the same time, not to say that the challenges should prevent employment of workers who experience language barriers.
Absolutely. Thank you so much. And I think it also speaks to just taking that extra moment, thinking outside of the box, thinking creatively. I think you brought forward a really great point of perhaps thinking, when is language required to kind of convey information, and when maybe visual cues can equally do the same job, as an example. So a great point to think about. I do see we have come to the top of our hour, so we will close for the day. But again, a huge thank you to you, Stephanie, for bringing forward this information and your expertise. And I'll just take this final moment to do a couple of closing housekeepings for our audience. So just a reminder that this presentation has been recorded. It will be posted on our website, along with, we will, as we've mentioned, share resources and the recording and everything to do with this webinar in our post communications. So watch out for those. For both organizational and WWI members, a reminder again, you will receive your free certificates automatically after attending this webinar. And if free certificates of attendance are catching your ear, please go to www.workwellnessinstitute.org and look to the Join Us section to see all of the different benefits that you have as being a WWI member, and even feel free to sign up today. And as a specific call out, if you are looking from a singular certificate just for attending today, please send your inquiries to memberservices@workwellnessinstitute.org. We will be sending an evaluation survey immediately after. You'll see it pop up once we end the session today, so please take a moment to fill that out. We really appreciate you taking the time to do so. And I'll just point forward that this webinar is a part of our continual webinar and educational resource programming, so you can click into the Learn and Connect section of our website to stay up to date for all of our upcoming programming, including our following webinar on February 22nd. Thank you once again to our audience. Apologies for going just a minute or two over. Thank you to Stephanie for your wonderful expertise in bringing such an important topic to our audience. And I wish you all a wonderful rest of the day, and see you soon in other resources and continual learning together.
Thank you so much.